So, Assalamu alaikum, a good afternoon, good evening, or good morning to all of you joining us from different parts of the world. A very, very warm welcome to each of you. I'm Dr. Sohela Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine and also an Associate Professor of Clinical Population Health Sciences. A very, very warm welcome to each of you joining us. So, as many of you may know who've attended the series before, the overall goal of the series is really to create community awareness about health and disease. And the ultimate objective of the series is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. So just as a reminder, this is not a CME CPD activity. It's for the general public. Just some housekeeping rules. Your cameras and microphones have been turned off. Please use the Q&A feature, the tab, which is available to type your questions or comments. You can also actually post your comments and questions in the chat section. So we will be able to see them. So if you are unable to post on the Q&A tab, please go ahead and put them in the chat and we should be able to view them. So questions will be addressed at the end of the session. I will be moderating the session. And as a reminder, this is not a CME CPD activity. No certificates of attendance will be issued. So we have a fantastic talk which is happening today. And it's really my honor to introduce the speaker, Dr. Stella Major. She's going to talk to us about family medicine is not just the front door, but the heart of the healthcare system. And I think I would have to 100% agree to this. And we'll see, what she talks to us about in the session. Hopefully, by the end of the session, you will also agree to that. So just to introduce Dr. Major, she's an associate professor of family medicine and holds a full-time faculty position in the Division of Medical Education at Weill Cornell Medicine here in Qatar. She obtained her medical degree from the Imperial College School of Medicine in London and specialized in general practice at the Northwick Park Hospital, London. She holds diplomas in child health, obstetrics and gynecology, and family planning, and is board certified in General Practice UK. A member of the Royal College of General Practitioners, in 2011, she was promoted to Fellow of the Royal College of General Practice for contributing to education, research, and clinical practice in the United Kingdom and internationally. She maintains an active license to practice as a general practitioner in the United Kingdom and in Qatar. She holds numerous awards in teaching and educational innovation and grants for course design and research in medical education. She serves as Deputy National Representative to the International Association for Communication in Healthcare and mentors students interested in exploring the use of virtual reality technology to enhance empathy and humanism in medicine. She's of British Armenian heritage, speaks numerous languages, and has a keen interest in linguistics, dance, and photography. Dr. Major, a very, very warm welcome to you and looking forward. Thank you so much for doing this session today for our community. Over to you.
Thank you very much, Dr. Sohela. Thank you for this lovely introduction, and it's my pleasure to be here with you and our community at large. I must say that the thing I miss most of all when it comes to webinars is that I don't see the audience. So I want to extend a warm welcome to you, and you can see me, but I'm afraid I can't see you. So I hope through your questions and your comments and so on, I will also be able to feel the energy in the room and your thoughts and your perspectives. So I'm now going to share my screen and okay. Are you able to see my screen?
Yes, all good. Thank you.
Okay, fantastic, fantastic. Well, Dr. Sohela approached me to talk about wellness and and I thought, well, as a family doctor, I can only talk about wellness in the context of family medicine. And over the years, I have been living and practicing across different parts of the world. And many people have, sort of approached me and asked me, so what is family medicine and how is it different to being a general practitioner and so on? So, how can we get the most out of our healthcare through interacting with our family physicians. So I decided that this was the opportune moment to, talk a little bit about the discipline of family medicine, family practice, and really kind of advocate for what I believe is, what the statement states, that it's not only the front door, but also the beating heart of our healthcare system. So without any further ado, I would like to begin. I do not have any conflict of interest to disclose. As you have already heard, I'm a fellow of the Royal College of GPs UK. And for the last 11 years, I've been a full-time faculty member at Weill Cornell in Qatar. And I've got the opportunity of, holding an active license to practice both in Qatar as well as in the UK. I do not have any conflict of interest to disclose. And before I move to the next slide, I want to say that what I'm going to talk about is the broad sort of umbrella of family medicine general practice. And in the different parts of the world that I've worked in, I've also worked in Abu Dhabi in the United Arab Emirates. I've also worked as a family physician in Lebanon. I will say that in different contexts, there are different adaptations, but broadly speaking, family medicine, family practice shares all the common characteristics. So wherever you've come from, wherever you've practiced, wherever you've been, served by a doctor, it'll be interesting for me also later on in the discussions to hear how much of what I'm sharing resonates with your experience or your perceptions. And I cannot start the talk without extending my biggest thanks. So when Dr. Soheila invited me to this talk, I thought, yes, this is great. And then I actually threw the net out quite wide and I said, okay, this is a community talk. And I sent a message out to my patients at large and said, what would you want me to express when I'm talking about family medicine in the community context? And so dotted around many of my patients sent wonderful, topics and themes, and really it all resonated with the main tenets, the philosophy of family medicine. And they were giving me all these examples based on their personal experience. So I want to thank them all. I want to say that in an anonymous fashion, I have kept a couple of quotations and I've embedded them in the talk so that it can kind of give some authenticity to the theory that I'm presenting. I've also reached out to some family medicine colleagues to see, what they would want to for me to advocate. So I've also, kind of chimed in some of their voices. And of course, none of this would have been possible if I hadn't had the mentors that I have had over the last several decades of practice. My goal today is to share with you, from my perspective as a family physician, insights on how our practice can support the well-being of you members of our community. But I would like to begin with a little bit of history, because although everybody talks about wellness and well-being, it's not a new concept. It's not a new term. It's not a new idea. In fact, right back in the days of Aristotle in ancient Greece, the term wellness implied doing and living well. Much more recently, the World Health Organization has adopted the definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. What I think both of these, the ancient wisdom and the modern, outlook on health and wellness sort of share in common is that it's not only when we don't have a disease that we are well. Our wellness is more holistic, it's much broader, it's multifactorial. And to this point, here to the right of my slides, you see the multiple facets, the different factors and elements that engage with the person at the center and they're within the context of their family and their community. There are different systems. There are the self-care system, how we take care of ourselves physically, emotionally, and what behaviors we engage with, the environments that we're in, the environment and the impact of the environment on us, our lifestyle choices, what's available to us within the community at large, within the cultures that resonate with us. So there are so many factors, all of these, like a rug, I would say, the different threads are, woven to enhance our wellness. And so it's with this, what I want to say is it's very, very rich, but it's also very, very fragile, because it means that there are many, many factors that can potentially, threaten our sense of wellness. So what I'd like to do now is, with the idea of what wellness is, how holistic it is, how broad it is, how multifactorial it is, and it's not just the organ system, it's not just the pathology in the heart or in the lungs or in the brain that, defines wellness. I would like you to hold this thought as I proceed with my talk and talk a little bit about, what are the principles of family medicine and how a family medicine, sort of outlook, if you like, can be one of the, if you like, advocates of wellness and sort of enhance our ability to maintain, our to strive towards a better, better health and wellness. I want to begin by defining what family medicine is and what general practice is. So these terms are synonymous. Many times people tell me, oh, are they the same? And the answer is yes. And basically, we are physicians who have, as Dr. Sohaila presented in my bio, so we have completed postgraduate training in the specialty of general practice. And the specialty of general practice contains a broad range of disciplines within the areas of medicine, spanning from birth to end of life. So from pediatrics right through to geriatrics. And which is quite unique, really, in terms of a kind of specialty program, because it's not discipline specific. It's, I would say, kind of longevity, focused on all aspects of our health and wellness. And where do we typically work? Well, typically we work in the primary care setting, in a community environment within the healthcare system, and we are accessible to our patients. We are their first physician point of contact. And so this is really important, and it's a major contrast to our hospital specialists and people whose focus and their training and their emphasis is on the disease, or sort of disease models, fixing diseases, where crises happen, where admissions happen, and so where hospital is really not, hospital is more for fixing the disease, and the home is where the wellness can begin and the wellness can be maintained. And so with this tenet, I also want to introduce you to the picture that I have here on the right. The World Organization of Family Doctors, WONCA, have defined family medicine over the years, over the many decades, and the definition of what family medicine is has been renewed and revised and has become more and more holistic. And the focus again around our work being essentially to, through the clinical roles we have, through our roles and communication with our patients and management of the practice, we're then essentially addressing the 6 main branches, and with each branch, the numerous leaves that really speak to the way we work in enhancing wellness, maintaining wellness, and coordinating the needs of our patients in our communities. So I want to just what the other piece about this definition is that it's an evolving thing, right? As our health ecosystems become more complicated, more broad, as the threats and challenges are, getting greater and greater, so is the domain, and so are the responsibilities of us family physicians within the healthcare ecosystem. So now you know who the people are, and you understand where our main, sort of point of practice is. Well, the main discipline, the characteristics of the discipline of family medicine are the big 5 C's, as they are referred to. It's a holistic way of offering continuing care, comprehensive care. I'll be elaborating on each one of these, in more detail. Coordinating care in a collaborative fashion in the community context. And I would like to, so with that, what I want to say again, the care, I want you to also think a moment, is not just episodic care. It's not just in the presence of a problem. So the care should be in the absence of a problem, because we're trying to maintain, by preventing disease, we're trying to maintain wellness. And I'll elaborate a bit on that as we go through the 5 C's. As we start with continuity, we start somewhere. It's a long line. We are the first medical contact within the healthcare system, and we are normality oriented. And this basically means that, we don't expect our, to be serving patients only when they are not feeling well, only when they have a problem. Of course, it doesn't mean that you just sort of, drop in there and have a cup of coffee. But the idea here is you don't have to be in a state of unwellness to be consulting your family doctor. To, coming in and talking about how to maintain wellness, how to look at the broader picture, is often what we do in our practice. It is a people-based discipline, and this is the first statement which speaks to the heart. Our focus is the people, the person in the room, and their story and their experience and their needs, not the heart in the room or the lung in the room or the organ specifically. The longitudinality of it essentially means that at any age, for any gender and any characteristic of the person, will be consulting the family physician around new norms that take place in our lives. And the continuity of it, again, means that it's not limited to a single episode, to a single reason for consultation. It's open, it's unlimited access. Normally, these are services that are free at point of care, and with the understanding that, wellness is a basic human right, and access to primary care is a basic, service that every citizen should be, should have, is entitled to benefiting from. In the continuity of care domain, also, I think one of the important things that we do to try to enhance wellness is to kind of advocate and assist people by finding what services are around and what kind of things exist in the community to pair up people's needs. And in doing that, we're trying to maintain a sense of stability and comfort, rather than these, crises situations. So the continuity is there to create this sort of harmonious, stable, comfortable space, which is easily accessible at point of care with no, financial barriers, where you don't have to necessarily consult when you're faced with a problem. In the context of normality, we want wellness to be maintained, to be recognized, to be screened for, and to be maintained. So to the bottom here, what I would like to say, this is one of the few quotes that I've decided to embed here. My patient, she decided that for them, the continuity of care meant that by knowing the person, their social determinants of health, planning and monitoring their health, and proposing a personalized self-care plan was what essentially, offered them a sense of well-being. And so I wanted to put that in there, as an example of how, owning and managing their wellness empowers and, renders them more independent. The second C is the comprehensive and integrated care. And comprehensive, it really is. It's, again, most of what we do, we know that most of what, where really benefit lies is in trying to prevent disease. And that's also where, the care can be more affordable. So we do a lot of, we invest a lot of our time on health promotion, disease prevention, in a holistic manner. I'll give an example here. So, knowing understanding a person's health history, understanding their family history, allows us to, sort of to determine whether they fall into a low risk, medium risk, or high risk group, for example. And we've just closed the month of October, which was our breast cancer screening month. So an example of the, understanding, well, knowing the person and their risks, and kind of stratifying them and directing them in the right direction for disease prevention is certainly one way of us intervening to promote wellness and reduce the delay, rather detect early if there are conditions that can be intervened with to enhance wellness. You see here that the wide sort of sense of the physical, psychological, social perspective of wellness are really core to the way we take a history. We ask about questions, and sometimes patients who have not been to family doctors before will, after consulting, will say, "You've asked so many questions about me." And and yes, it is really about the person to understand comprehensively who they are and how they choose their choices and their lifestyles, and to identify where we can enhance and promote greater wellness and well-being as priorities for them. The other important thing I will say is, it's about efficiency. So, a lot of the time you will find that in a consultation with your family physician, you don't deal with one aspect, and you may have an acute issue, and then there may be sort of ongoing health issues and concerns. This is in contrast to the visits where you go for individual consultations for the disease model. So here, again, wellness with efficiency, with time, with understanding, the numerous threats to wellness that can occur in our lives. The comprehensive integrated care opportunity allows multiple things to be addressed in a single visit, for example, or indeed in a single healthcare environment where you're having maybe not only the family physician but the other members of the team providing care. So I wanted to, so this is not a C, but it's really about the relationship. So we really the the core of our physicianship centers around the relationship that we build with our patients. With time, we focus a lot on effective communication, and this is an area that you will find most family doctors will also be very busy teaching, because this is an area where a lot of our training is actually focused on really learning to be active listeners, and to use a lot of effective communication skills in a therapeutic manner. What I want to say, again, the quotes here, are talking about the relationship, kind of instilling trust. And one of my patients said, this relationship has made me build, have trust. And with that trust, I'm able to therefore, fully open up and tell my doctor what my concerns are, and therefore ultimately also get the best, care and advice, that I wish to. Another patient of mine also shared his or her views and said that, with this relationship, and this sort of intimate understanding of the person, the doctor is able to detect changes in their mental health early on and trigger modification strategies and offer support. So again, I think a very unique example of a situation where with this ongoing relationship, we don't need to, things don't have to become severe for wellness to be, for threats to wellness. I feel like, minor changes can be detected when there is a longitudinal, sort of familiarity with the person, with their, health, so to speak. And again, intervening early on to try to support and enable, the person to regain their wellness is central to, to how this enhanced doctor-patient relationship can work. The context. So I did say that, family medicine is not just the door, but it's the heart. And it is. So again, this slide is really, adding some more depth into the patient-centered discipline. The context is very individual, is very, very specific. So, no two individuals who will consult me with the same, sort of diabetes diagnosis, for example, are indeed the same people. And in family medicine, we really focus on understanding the person with their specific beliefs, with their, within their individual worlds. And we find that, even within, understanding that and incorporating that into into the therapeutic conversation, often brings another layer of wellness, because individuals' needs and personal choices and cultures are recognized and are not only recognized but are respected and included in the discussions and the management plan. I will also say that the relationship is often, in many cases, that very strong doctor-patient relationship is enough for patients to walk out of the consultation feeling relieved and not requiring a prescription, not requiring medication, not requiring anything. So the doctor-patient therapeutic encounter itself is one of the strongest tools that I would say we hold in family practice, which is sort of the enables wellness again. I find that the look on individuals' faces when they're coming in with the concerns and the worries and so on, brightens as as they leave. And so that therapeutic relationship, it cannot be underestimated and is really central and core to the way this longitudinal family medicine relationship and core values operate. The third point here I want to say is that the onus is also on us very much to understand our limitations, because and our attitudes, our strengths, our beliefs, because when we build this very tight partnership, it's very, very important that we can see our blind spots and our biases. And so this is another layer, of in the therapeutic relationship. We have to be as mindful of our own, if you like, sort of unique values and beliefs as we take on board our patients' values and beliefs. So it's a very complicated and very sophisticated situation where the relationships meet and hopefully try to kind of make a connection and a mutual understanding. So the third and fourth C's are the coordination and the collaboration. So as I mentioned, obviously the contact starts whenever the first contact starts. And, an important role we have is in making sure that we understand, whether to promote wellness, we need to onboard other care providers, and whether we need to, onboard people in the primary setting or in the secondary setting. knowing our communities, we can also then, often recommend what's closest available, and that also adds to the convenience of the care and the self-care that patients enjoy. We work across different teams. This is something that's really important. As doctors, we often have very short consultation times, but really the benefit of the care that we're providing is often amplified when we work across different interprofessional colleagues with common goals and common aims. We delegate, and this is another example. So we delegate, the care to best match the needs of the individual, and also the access to the services, the resources, the time that they can spend with an individual. So for instance, people who are interested in quitting smoking, for example, and they want to go through counseling, often that you'll find that quitting smoking as a step towards feeling, taking better care of themselves, for example, you'll find that you will meet the physician, and the initial conversation will happen. Maybe some medication might be prescribed, but often you'll have a lot of the smoking cessation counselors will be working hand in hand with the family doctor to invest more time and to basically help the individual progress in their journey of overcoming a habit and achieving greater wellness. One of the other things which I think is really important to realize is that by coordinating care, we're actually again trying to be as efficient, both in the use of the resources, but also in the use of the access to resources from the patient's point of view. We advocate for our patients. Often I find that in the absence of that, people will go from A to B to C. They don't know necessarily what they need to be telling to different people, and so they often end up falling in the cracks. So the coordinated and collaborative, role that the family physician plays can really help the individual who's seeking wellness, sort of get on top of things, get on top of understanding how to navigate this very complex system that we operate in. And I urge everybody to, rather than self-refer, to make sure that, if there is really a need to go into secondary and tertiary care, that it's done with the advocate who's on your side and presenting the information that's going to get you the best out of the referrals and the consultations with the secondary and tertiary care. Again, so another thing about our, community. So, rather than in the situation where a person is in hospital and they have an acute problem, and that problem is being dealt with, and then they're discharged out. In the family medicine context, it's everything around the person and their home and their family. So we look at the family circumstances to understand where the stressors may be, and also where the support may lie. The social and cultural networks that may be able to support the individual and their needs, their work environment, for example. So all of these, and certainly there may be some local prevalence of conditions and so on that come into play when we consult our patients in certain environments and specific communities. So again, we think from a family and community-oriented context, both in defining diagnoses and in sort of planning together how to plan treatment plans and wellness plans. This brings me to the other part of the opening statement about gatekeeping. And what I want to say is that, gatekeeping sort of is a harsh word, but if you think about it from a positive context, we also want to, the role of the family physician as gatekeeper to the very complicated healthcare sector is that we're really, of course, assuming that the best interest of the patient is the first and, is the primary reason for acting as a gatekeeper. We often end up actually benefiting the patient by protecting them from over-medicalizing their problems and from having unnecessary tests and unnecessary, treatments being thrown at them. Unfortunately, healthcare is very complex. Navigating it is very complex, and I think trusting a gatekeeper who's taking care of your wellness, because your wellness is the priority, is actually a great asset in terms of both protecting you as the individual, but also advocating for the best use of our finite resources. So I'm stating that gatekeeping sounds horrible, and many people sometimes say, well, it's like limiting me from accessing what I need. But in fact, when there has been a good conversation around what you need and what you are asking for, often we find that actually it's not a gatekeeper role anymore. It's a shared decision making, and there is better understanding of the need for secondary and tertiary consultation. The bigger gatekeeping, the wider safeguarding responsibility is, if we go back to the original understanding about wellness, is it's not just the individual, it's within their community, it's the environment around, and we have responsibilities to role model this, and to, if you like, to encourage, if you like, wellness in the broader sense, to advocate when there are, toxins, where there are environmental triggers and risk factors, and to escalate that, so that we can then diminish the risk of harm being done to communities around where we live. So what I want to do at this point is, I've really kind of tried to go through the 5 C's, and I've talked about them in terms of the tenets of family medicine, and also, how we are the heart of the system, and how we also are the gatekeepers. And hopefully, for you to to see that the harmony of the 5 C's and the gatekeeping role, as well as the the heart throb with the relationship building, is there to advocate for a person-centered holistic wellness for our community. I think at this point, what I'd like to do is, take a pause, and maybe just before that, if there is anybody interested, there are some references at the end of my slides. If anybody's interested in the resources that I've used, those can be shared, I'm sure, through the IPH website. But at this point, perhaps Dr. Sohaila, we can open up the floor to comments, questions.
Yes, definitely. Thank you. So maybe if you can stop share and we can go to full screen. Great. Thank you so much, Dr. Major. That was really a beautiful talk. I think a lot of the terms that you use resonate very close, to my coming from, of course, a medical background and a public health background. So, and I love the way you sort of, put the 5 C's together, putting, how you connected each stage for the community, and ultimately, providing that holistic wellness approach for each individual in the community. So thank you so much. And also, I love the inclusion of, the quotes directly from the patients. So very, very heartwarming to see that. And also how you've used art in sort of elaborating, so that was really nice. Again, the humanistic sort of side, I can just see that coming out. So I'm just going to start off with a few questions. Again, just focusing maybe on, I really love that you said that we are normality oriented. So it's, we all know in the medical system, we are all trained to be disease focused.
Yes.
And so rather than thinking about health, we're thinking more about disease and, oh, how do I fix this? Or how do I, I'm that detective and how do I look for that? But really, really, as a GP and a primary care family practice physician, really glad that you sort of said that we focus on wellness and prevention.
Mhm,
So, again, in today's era where we have a lot of access and the community also has a lot of access to online information,
mhm,
how
mhm.
do
Yes.
you, tell your patients, what are some of the reliable sources of information they can look for?
Mhm,
Because again, social media,
mhm,
is a two-edged sword. So we
mhm,
also have now influencers, the so-called social media influencers our patients are, listening to, they follow them. And
mhm.
sometimes some of the information which is being given is incorrect. So, what advice would you give to the community about that? How do they navigate
Yeah.
this big issue in our era nowadays?
Yes, yes. Thank you so much. I think that's very important. I actually, I feel very happy when anyone who's coming to talk to me, as their physician shares with me information and their sources of their information, because
Right.
there is such an explosion of information in all, in all manners, if you like, and you know, um, I think for us to assume that we can be on top of everything, and particularly in a field like family medicine, which is really very, very vast,
Yeah.
is not being honest. So, I will have patients, for example, who will come with very, unusual, like, well, not unusual, but with very special concerns, and they will say, I would like to have a certain type of injectable treatment for my familial cholesterol medicine
Mhm.
because my father has told me this and he sent it to me by news, in the newspaper or whatever. Um, what I say honestly is that uh, our practice, is centered on best practice. So um, I think patients, people, all of us have a natural, sort of curiosity. We want to read. We want to, find out information for ourselves. I think it's what's important is for people to feel comfortable to bring their resources and to discuss it, with whoever is their trusting care provider. There are definitely some health resources that are vetted and are evidence-based. So it also does depend on the interests and the needs of the person and the language, for example, language spoken and the level of health literacy. A lot of patient information, that is prepared, with a professional involved is accessible and is also open to review. There are some sites that actually I use in my regular practice, and when my patients ask me where do I get this information, I forward that to them, um, and especially that those are actually accessible in over 50 different languages, and so it allows people to access information and read it in a language that they feel most at ease. But generally, my takeaway is this, anytime someone brings something, I welcome it. I want to see where it is what it is that they have understood. If I'm familiar with it, I will, go ahead and elaborate. If I'm not familiar with it, I will, in practice, sort of say, let me check with my own resources and come back. But I would say, in general, that people, um, well. It's best not to, you know, well, let me backtrack. So one of the things that often happens is people say, well, I read last year you were saying that aspirin is the best thing, and now you're saying aspirin is the worst thing, and guidance is changing, and we are confused. And um, I would say, keeping abreast of health information is very good, but check in with their trusted healthcare providers. Um,
Mhm.
and I would also say, help us by telling us, if it's not clear, if our explanation has not been effective, tell us.
Right.
The worst thing that I can think of is that we think we've done a good job, and then people go home, and some, and the benefits of that conversation essentially, fizzle away because we haven't really made ourselves clear. So I would say I would say read as much as you wish and bring
Yes.
information to us, and let us know if we've been able to address your concerns. Um, I hope that
Sure.
answers Dr.
Yes,
Sohail.
that's great. I think that that's a reasonable answer with like you're saying, that there's just too much of
Information.
information just evolving, in seconds, something can just go viral,
Exactly.
as they say nowadays. Dr. Major, just you spoke about a very important point, about protecting patients from over medicalizing their
Mhm.
problems.
Mhm.
So, in today's day and age, how do you be that gatekeeper? Like
Yeah.
sometimes, people just want, a name given to what they're experiencing or something,
Yeah.
So, how do you sort of engage with patients for them to understand
Yeah.
that maybe they're overthinking or over medicalizing what
Yeah.
issues they may be experiencing?
I think that's a very difficult thing. And I'm sure that sometimes we are successful in that, and other times people, I mean, everybody eventually decides for themselves, right? I think the bottom line is to, um, again, about effective communication, explaining, why I would recommend a certain, referral or not for this, and
Mhm.
it's partly our responsibility to be clear with our patients and to help them understand our thoughts, but it's also understanding what, their concerns.
Yes.
I think if we give enough time, and we really listen to both sides, often we find that we're actually in agreement because our goal is exactly the same. It's what's in
Right.
their best interest and what's available. And, then there's a discussion about harms and benefits.
Mhm.
I think when consultations are rushed, when there is little time given to listening to the patient perspective, when the risks and benefits are not discussed, then it's very common that people, particularly with health insurance, will just go doctor shopping and go from, one place to the next. And there is literature to say that, doctor shopping actually results in more medical harm because more medicines, more prescriptions, more tests, very important resources are wasted. And yeah. And often what happens in this situation, from my experience, is that when there's a lack of trust and there's a lot of doctor shopping happening, we don't necessarily know what others have been doing or saying. Often patients will not share all of that information. And so that also puts them in greater risk. Um, so I think it boils down right at the beginning to be very frank and clear about our understanding and to understand, really what the agenda of our patient is, and then hopefully come up with a shared agreed plan.
Right. Thank you.
Uh,
Thank you for
yeah.
that. So just another question about, of course, we know that chronic illnesses are very common, and
Mhm.
then different families, people may be suffering, from one, two, maybe more chronic illnesses at one time. How can we support family members? What is your advice who are dealing with chronic illnesses? So there's a lot of pain and suffering associated with it. How can we support family members, in their chronic illness journey?
Well, I love that question. And I think that there are probably many ways, and we probably are really failing at that most of the time. I mean, it starts by understanding you know, um, well, what's going on in the family. What are I think one can't generalize, but
Yes.
it's important to understand every family as an independent unit, as an individual unit. Um, and I think also, not assuming that what we can give is what they need.
Mm-hmm.
actually having the humility and the curiosity to ask, what it is they would want sort of help with, whether it's information, whether it's maybe respite, whether it's, kind of having extra, well, you never know. I mean, I think definitely chronic disease is, now, well, it's the number one, problem for all of us, and has a major impact on everybody's wellness. Um, what I think what I would say in short is to be aware that in families, people hold multiple roles as caregivers, and often these caregivers themselves will have health issues, you know,
Mm-hmm.
um, and the best thing is for care providers to make sure that they get the healthcare needs, their own healthcare needs, and not to just, be caregivers, also to make sure
Right.
that they have their own healthcare, and to bring us questions, and for us also to, um, be curious and ask them, because also I think their needs change with time. And so,
Sure.
again, it's not at one point in time, it's
Yes.
over time, um, planning together and maybe investigating, what resources there may be around so that people feel prepared.
Right.
Often with chronic disease, things progress. They go
Sure.
from, one stage to the next. So again, readiness gives more control and more, I think, a sense of well-being,
Great.
whether you're in the shoes of the patient or indeed the family caregivers.
Yes. Thank you so much for that. So, just alluding to that same, I mean, not only that context, but of course, we know, stress, anxiety is very common nowadays.
Mhm.
What tips can you give to our community to, manage stress and anxiety in the day-to-day lives?
Gosh, I mean, the tips are, I say, maybe, I don't think there's a magic
Yeah,
cure.
right,
I think the more aware we are, of our, if you like, our self-measuring tool. I can't think of a better
true,
way of putting it. I think it's in, self-awareness
right,
helps. Seeking, talking about it, actually, not I guess the best thing is not to shy away from reaching out and saying, what, I would like to talk about how I cope with stress. Sometimes actually people will come with a concern, and then when we unpack it together, they realize that it's the stress that's made that happen. Because a lot of the time, stress is, kind of, it's not in the front of our mind. It's like a headache is in the front of our
right,
mind. I don't know, a
right.
flare up of acne or something.
Sure,
They see, they come for something they can see, and then as you unpack it, you see that the trigger underneath all of that is stress. So
right.
I think it's lifestyle. It's lifestyle. It's helping them figure out what are the triggers,
Yes,
teaching them, relaxation techniques. I don't know, exercise, yoga, dancing, whatever it is that speaks to them, that gives them a chance to step away from the tension. Sometimes troubled relationships. The important thing really is, to have a low index of suspicion, to check in with their trusted care provider, and to try to, find the best way for them, to overcome it, not to hide it, not to deny it, and not to feel embarrassed, because also we find sometimes people feel that it might mean that they are not strong and they're not coping. In fact,
yes,
it's quite the opposite. You know,
right.
so yeah.
Sure. Great. No, thank you. Okay, and I think we are coming to the hour. So just one last question.
Okay.
You of course spoke a lot about prevention and wellness and how we want to focus and try and engage people in self-care.
Mhm.
So give us some wisdom, some key pearls, that people can engage in to look after themselves, for their overall health and well-being.
Yeah, great, great. I think a couple of things. I think again, with wellness being not only physical wellness, emotional and psychological wellness, I think it's very important to make sure that we surround ourselves with people with good energy. I'm going to
Good.
start with that.
Yes.
Having,
You want positive, good
yes,
energy.
I
Yes.
think, I think, respect when you feel that their energy around is not what your body feels well with, don't
Hmm.
tolerate it. Do
Yeah.
something about it. And then just continue, trying to keep a balance between, all the different things you have to do. Make sure sleep, if you can address. I find that restorative sleep is really very helpful. It helps us, make better choices in regards to everything. I think also if you have the opportunity to really eat mindfully, like for example, not rush through your meals, sit at the table and not kind of do it behind the computer quickly if you can, and have a healthy social network so that your friends can help you, support you, you can support them, and have a purpose. Um,
Yeah.
there you go. Those are my takeaways. And I, and I will also say we're not all, maybe I can just conclude by saying it's
Yes.
not a flat line.
Yes.
It's a journey, and there are times when we feel that our wellness is being threatened, and there are times when we feel we've got a good handle on it, but not to fear it when we're not in the state of wellness, but to keep actively trying to seek it. I think that would be perhaps my message to all of us.
Yeah, sure. No, and I think that that's a beautiful way to end your session. That,
Thank you.
life is, of course, a journey. It's dynamic. We have our ups and downs, and that's totally fine.
Yes.
So I think, thank you. I think we will
Okay.
end on that positive note.
Excellent.
Thank you
Yes.
so much, Dr. Major, for taking out time from your very busy schedule. We're really, really glad you could spend this time with the community, and
Thank you.
inshallah, they've benefited from it. So, all our audience, thank you so much for attending today. And please make sure, as Dr. Major has, asked us, look after yourself, give yourself importance, develop a trust relationship with your general practice physician, and inshallah, you will do well. So take care, and thank you so much again, Dr. Major. And we
Thank
will
you.
be signing off now until our next
Thank you.
session next month.
Thank you.
So
Bye-bye.
bye-bye. Goodbye to everybody for now.
Bye-bye.